All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. Thank you very much for being here. And when you see me in the beginning that I look this way, I look at the broadcast studio to see if the live button has appeared. So here we are, D. Diaz first, Jenna Teller, hi, how are you doing? Steve, first like, thank you very much, Steve, for the like. Hot Chili Bean, Beans, hello, back to you. Christy, hello, back to you. Carolyn, hello. Ali G, hello. Hello, everyone. Doug is here. Hello, Doug. Lizzie, Jana says 4 more days until my next IVIG infusion. And how is that working, Jana? Is it helping? Mercy says back, welcome. Nancy is back, welcome. Susan Pick is here. Hello, Susan. Zia is here. Hi, Dr. Bean and Cool Beans. Hello. And Chantel is here. Okay, so couple of things. One, over the weekend, the conference I think it went very well. I saw some of the Cool Beans there as well. Margaret is back. Welcome, Margaret. Roman is here as well. Welcome, Roman. And Paul is here. Melanie is here. There are lots of people here. I actually saw Cher after a long time today as well. So Gold Country Russ is here. Gold, how are you? Has Been is back. Yes, we have Has Been back. Welcome. Can you see the Twitchies? Yes. So Krebs for Suzette says, can you see the Twitchies, Dr. Bean? Yes, absolutely, I can. Great talk with Dr. Teslari. Thank you very much this afternoon. Thank you. Jana Taylor is saying you're famous, Dr. Bean. Am I? Where am I famous? Am I really a famous person now? Yashraj Padia says, so he's starting with a question. Yashraj, let me just quickly talk about the conference. So the conference went very well. Interestingly, the first day I woke up 4 o'clock in the morning and took the shower and became all ready. And as Doug had said, to warm my, my voice as well, I sang a lot in the shower. And then I started the Zoom and there was nobody there. And actually there were 2 folks. And I said, why are they not accepting my Zoom? Why are they not letting me in? So it turned out I was thinking it starts at 5. It was actually going to start at 7. Still too early, inhumane time for a Californian, but still it was much better. So I was up and ready at 4 and joining them at 5. So they then asked me to wait a little bit. The conference went very well. The thing that I really loved, other than hearing Dr. Carvalho and other doctors, Dr. Corey, what I loved was the first day. I do not know if some of you actually liked it or not. The first day were statisticians there, which are part of, I think, Dr. Laurie's team. And they were showing why the ivermectin data is actually good and why these studies are good. So if you can find time to look at the statistical analysis, it seems a little mathy and kind of maybe a little complex, but that is the most important thing that is happening. We doctors talking about ivermectin works and hey, we should use it is fine. Everybody, lots of us are saying it. It is the statisticians that are putting the data up and saying, hey, WHO, you really didn't do well. Here is the stats. That I think was very interesting. Then the second day, Dr. Pierre Corey, Dr. Hector Carvalho. I also love Dr. Chesler's descriptions of his work. He had 5, 6, or 7 geriatric centers where there were old folks, and he was saving them with ivermectin. And he said, I think he tweeted it, or he said that I tried to reach out to Fauci and sent him my results and asked him to maybe talk about it, but he didn't hear anything back. So this is where we are with those discussions. This morning we had Dr. Laurie again. We were going to have Dr. Fareed Jalali this Wednesday. I had a talk with him. He wanted a little more time to prepare. So what I feel proud of is that when a doctor asks me that, hey, your audience, how should we structure our talk? How detail or depth, deep or not? And when I respond and I say that we've been working together for a year and we understand the mechanisms to whatever degree you want to take us, we will go with you over there. and their eyes open up and they say, yes, I can discuss pathophysiology with ease. And I said, yeah, please do it. So he said that could I have a few more days to prepare my slides a little more. So he would join us on Monday. Next week we would also have Dr. Corey with us. And one more thing, that is that FLCCC and I are working together to create for long haul. So that algo is, so Dr. Corey and I have been discussing it, and we're going to put that on FLCCC. He had offered me to put it as Dr. Bean's algo, and I was not very much interested that it should be with my name or I should be called out. But he wanted to, so he said, we can just put it with your name. And I said, no, let's just do it together. Hey, Luffy. And he said, so it may be FLCCC-Bean algorithm for long haulers. So that is these are the latest news. Let's see now the questions and see how is everyone doing. Hey, Luffy. What are you doing? Luffy's right here. Okay, so let's have some questions. Luffy is famous too. So yesterday when the conference started, the day before yesterday, on Saturday, both Luffy and Kari came in and they started running around. And I was speaking. So I was just counting on the lucky stars that they don't start meowing the way they do it right now. But they played a little bit and they went away. Hey, Luffy, what are you doing? Luffy is something. He knew I wanted to grab him, so he ran away. Okay. Let's see So Andrea says that cat sound mew is cute. So somebody had put a comment today that why do you not feed your cat and why do you keep him starving? I have been working with cats for a long time. You are starving your cat. Am I starving your cat? You, Luffy? You have your food everywhere and people think that I'm starving you. So, all right. So Jody says, if someone has an issue with post-menopausal bleeding, which has not been resolved, would it be possible for the vaccine to exacerbate the problem? So vaccine probably would have less to do with this. The reason for this is during the fertile time, during the menstrual periods time, the bleeding is occurring because of the sloughing off of the endometrium, and that is part of the cycle. After the menopause, that part is not occurring. Now the problem, if there is a bleeding, there can be many problems. There could be a damage to the wall, there could be some tissue there could be there are many things. I don't want to create a different diversion here, but there can be many reasons for that. Those reasons have nothing to do with the inflammation like we see during a menstrual period. So vaccine would probably have not much of an effect. Jenna says yes. So he does that. When I go down to pick him up, he runs away and stands over there. And when I come back to this table, then he comes back. Fishtail says, hi, Dr. B. I listened to news from India. So for all stations, not a mention of ivermectin. That is amazing. And that is really interesting that, let me open the door for Luffy, please. So the discussion yesterday with the India's situation was that the ivermectin dose need to be doubled. So I hope that works. I do not know why ivermectin. When I say that ivermectin is not being used, then I get a lot of comment from people saying, hey, we are using it. But when I talk with the people over there, with my friends over there, with my doctor team members over there, they say we're not using it. So it looks like some places they're using and some places they're not. Nina says, drug companies won't share raw materials. Messenger RNA can cure cancer. It can cure cancer, and I think Moderna, we should bank on it. Now, they are sharing the raw material or not. I think there are commercial interests, which we are seeing all the time over here. Dr. Hector Carvalho had in his slide, he had a very interesting cartoon where there is a um, coronavirus, and that coronavirus is being milked by the corporate. So the world is running after the money brought in by coronavirus. Asya Zadi says, I do believe it's the low dose of eye medicine that's not working correctly here in India. Yes. So let me explain why the low dose and high dose difference is appearing. So let's say here is a cell, and here is one more cell, and here is one more cell. Virus enters this cell. Ideally, it can enter all those three of them together, but I'm going to just move it in a series to explain what the dose means. So let's say the virus enters here. Then it would replicate here, then it would come out of here, and then go to the second cell, replicate, come out, go to the next cell, and that is what it would continue to do. Now, ivermectin is supposed to disrupt this virus in this place. But imagine if the virus has become so fast and the quantity of ivermectin is not sufficient. That means what is happening is, right in the beginning, when the virus enters, there are too many viruses that have entered, and there is too much replication they're trying to do. And ivermectin, if the dose is not right, it's not going to be able to disrupt them that much. And it is going to become overwhelmed by the contagious virus. So in this case, the dose has to be increased. So what they were talking about was doubling the dose. Rima, I see you after a long time. What is happening in India, Dr. Bean? So we have discussed this many times. Number one, I think ivermectin dose is needed, which is needed to be doubled as well. Number two, ivermectin is not very commonly used. I'm seeing so many articles that say, now I do not know what is true and what is not. Some say that, hey, it is the vaccine companies, they're trying to sell the vaccine more, they don't want ivermectin, so there is a policy to suppress ivermectin. Some say that, hey, we do not have sufficient ivermectin. Some say we actually don't think it is working. And so there is all kind of news over there. But I still firmly believe that if, while the vaccines would come in at some point, the ivermectin dose, increasing that dose and giving it would help. So yesterday, the audience, the speakers were saying that in Uttar Pradesh, it is still better than other states because they're using ivermectin. And Rima, just in general, why this all started happening was there were so many congregations of humans, of people a few months ago, and that all has created a perfect storm. There are variants, then there are congregations of millions of people, and now we are in this situation. Did you say Dr. Sukarit Khadi was going to be on Monday? I think Dr. Fareed Jalali is going to be on Monday. And then Dr. Pierre Corey will be as well. More questions. Arubaga, seen you after a long time. How are you doing? Could vaccine side effects trigger long hauling? So in theory, no. And the reason is very simple. What happens is, for the virus to create, now long hauling, I was thinking, because long hauling can be due to many reasons. One reason for long hauling can be virus sticking around in the cells for a longer period of time. So sort of a carrier state. Another reason for long hauling could be virus particles sitting around in the cells for a longer period of time. Another reason for long hauling, and this is what is important, is the immune cell mutation, which may or may not be permanent. And what does that mean? So what happens is, in our bone marrow, so let's say this is some bone, and in here there is bone marrow, and that is making immune cells, meaning that is making natural killer cells and T cells and B cells and macrophages and dendritic cells, and all those cells are being made here. And when the virus is attacking, and these cells are being made in a rush, and maybe even virus attacks the bone marrow as well, we do not know yet. So when these are made in a rush and they need a specific gene to be opened, sometimes they can get a gene mutation in their parent cell, which is just opening and dividing and opening and dividing. And that mutation becomes part of the parent cell. This is what we say virus hit and run. So this mutation now is going to stay. Hopefully, when the virus is gone and after some months, this system calms down, and then the cells get a chance to bounce back towards normal, or some doctor gave steroids and that suppressed the system for a few hours, days, and then brought it back up, and the cells went back to their reset default state and they are okay. But it is also possible that this mutation is now part of their life. Their DNA has changed in a way of opening, not change as a mutation in the DNA. But what happens is all of our cells, so let's say this is cell A, it is possible that this gene set is open and this gene set is locked. It is another cell, let's say this is liver cell, liver, and let's say here is a kidney cell. In the kidney cell, it's the same DNA as well, but this part may be locked and this part may be open. And in the skin cell, maybe this hole is locked and this part is open. So every cell has the same DNA, but the expression of genes is different for their function. So when the virus arrives and it revs the engine extra, that can actually cause some genes to open up and they stay open, and that is how the activation occurs, which could be autoimmune disease eventually. So now going back to the question, could a vaccine do this? Vaccine fortunately cannot do this because vaccine is not actively dividing entity. It is going to come into a cell, go there, whatever quantity you gave, that quantity is not going to increase. And that is fixed quantity. It went in, it did whatever triggering of the immune system, training of the immune system, and done. Virus can actually continue to replicate, which continues to stress out our immune system and puts a lot of burden, especially the SARS-CoV-2, which can cause hit and run. There are other viruses before SARS-CoV-2 that have been known to do this as well. That is why we know these mechanisms. So infection versus vaccine, there is a huge difference. Tom Johnson says, Dr. Bean, did you hear about Israel's health ministry said on Sunday, it is yes. So I actually heard about it and I am going to present that soon as well. Some cool beans were asking about how are we doing. So I had Mrna first shot. My wife had Johnson & Johnson. My son has Pfizer. So I had, before the shot, I had some inflammation in this part of my throat. And that has not gone away since the shot. And I can actually explain, just like today with the irregular periods, if the inflammatory cells are active here and you add more cytokines to them, they're going to stay active. And if the body is making antibodies at this time and they are helping make more inflammatory cells, cytokines, then those areas which were aching because of inflammation are going to keep doing that for some time. My wife's headaches have reduced a lot. Her blurry vision and the swelling in the eye has gone. I definitely feel that this was something to do with the clotting. Luckily, I had put her on blood thinners, so she was much better. Yesterday or day before yesterday, she scared me by saying, I think I have a bruise on my foot. And I thought, all right, this is it. But luckily, she had bought a new shoe and she was wearing and walking, and that had caused some issue with the nail. Anyways, her joint pains have subsided a lot. After the vaccine, for 2 or 3 days, she could not even walk correctly. She would walk like, like a robot. But now she is back to normal and walking. My son had Pfizer a week ago. Since then, the things that he has felt were, number one, his GIT became very, very upset. So he called me multiple times saying that, hey, looks like I have some issue with the GIT. Looks like my GIT is bad forever, and I think it is one of the side effects of the vaccine. He's settling down now. And the second thing that he complained was he couldn't sleep. So he said, I can do whatever, I cannot sleep. I'm just too alert. So then he talked with the doctor after not being able to sleep for a couple of days, and they have given him sleep meds. And today he told me that he was able to get sleep with some patchy interruptions. So is it a new thing, or is it vaccine related? I think vaccine related, because he didn't have this before. So these are various vaccines in my family and their responses to our cells. Yes. So Janet, she did walk. This weekend actually was just working. The last weekend she did walk about 10 miles. Usually she walks 4 or 5 miles a day. And then when we go to San Francisco, then she walks more over there and adds. Samina says, any change of the recommendations on ivermectin by WHO after the conference? No, I don't think that. Look, WHO picked a fight, and they knew that they will win this, because who's going to go and ask WHO to fix it? So that's not going to change. I like Dr. Laurie. So once her recordings come out, she had a closing statement which was so powerful that I first got the goosebumps, and then I started having tears. And of course, she was tearing up as well, although we both controlled it. Powerful statement. And in that statement, she was saying, we need a new WHO. This WHO is not people oriented, and we need to move on from this WHO and form an organization that is people oriented. And I totally agree with that. It's worth hearing that statement from her. Arun says, can steroids be given at the time of vaccination to suppress cytokine abundance? The question is that, do we have cytokine abundance? If you give steroid is strong enough that it is going to suppress the immune system and may not allow the vaccine to do sufficient work. So it really depends how much of the overactive immune system is, how much of the autoimmune diseases are there. So far, they have said in the trials that they gave the vaccine to autoimmune disorder folks, and it was fine. Franz says, Luffy will give us his impression of ivermectin man if you pause. Absolutely. Luffy has been running around here. Yeah, so pause the like button. Bambi says, glad to hear she's okay, Dr. Bean. Thank you very much. Yes, and I'm hoping that my son improves soon as well. My jaw has improved a lot, but not fully yet. Mel A says, hit thumbs up, free, no cost. That's absolutely correct. Liza says, Dr. Bean, how old is your son? He is 27. And he is good. So my son, I got married when I was in fourth year medicine. So I was 23 years old when I had my first child. Muhammad Tosif says, question, my father started whooping cough when he inhaled day 14 CRP 30. When he inhaled. So so it looks like he has bronchitis. Please take him to a doctor so they can listen to his chest, they can do his X-ray, and then figure out how to manage him. L says, calling all cool beans, please help Dr. Bean and hit the like button. Absolutely. Thank you. And there are some super chats as well. Thank you very much for that. Christine says, Dr. Bean is so nicely proud of his son. Absolutely. So when I love poetry, and so I write poetry as well. So when he was very young, Hassan, he had no idea what poetry is, and I needed an audience. So he was 4 or 5 years old. So I'll come back from hospital, and I would have him sit down at dinner in front of me, and I'll say, all you have to do is say, I love it, I love it. And so I would recite my poems or my verses, and he would, without knowing, say, "I love it, I love it." And I still remember that vision. So, and he remembers it too. So I have used his audience for my benefit. Larry says, "Hi, Dr. Bean Sayed. Watching from Philippines. Keep and every day posting to Facebook FSCC videos with regards to ivermectin. Thanks for the information. You're very welcome." IZ says, "Am I the only Gen Z here? Don't know." Fun says, question, natural infection, then one dose of vax gives the needed immunity, but one dose of vax, then natural infection doesn't give the needed immunity, and officials advise taking the second dose. How come? Um, Natural infection, then one dose of vax gives the needed immunity. But one dose of vax, then natural infection doesn't know. So this is not correct. Natural infection, and even if you didn't take the vax, it would work, but one dose, fine. Similarly, if you have a dose of vaccination and then you got the infection, and you got the infection, meaning the vax did not. So think about it. If vax protected you, then do you need more vax? And if, let's say I got the vaccination dose 1 today and I got infection tomorrow, I got symptoms tomorrow. Now that infection is going to do its job and produce a lot of antibodies, why do I need to go and get another dose? But having said that, please see whatever way you and your doctor decide. This is mechanism. From a mechanism point of view, these things don't make sense. Rubies, Moderna last Thursday, and no adverse reactions except a sore arm for a few days and mild fatigue. Very good. So I had sore arm, no fatigue. I became a little tired the next day. I just wanted to stay still, but I had this jaw pain that is not gone yet, or temporomandibular joint, hopefully. Mary Reed says, question, Scotty Bean, welcome. How can I watch the weekend conference? So they are now in the process of editing it. Once they have edited it, they have a plan to post both days together, plus they are going to separately cut them into smaller pieces for each person's presentation so people can watch smaller parts as well. So I think it's going to take a few days. And once that is done, I would announce it too. They would announce it as well. And I'm sure I have, so I believe that Dr. Laurie's YouTube channel is blocked. So I had asked her to make a new channel. We'll see. Ariana says, Dr. Mubin, I just had the Moderna vaccine first shot and no symptoms at all. Should I be worried? Thank you. No. So some people actually have no symptoms. It is totally fine. That doesn't mean that the immune system is not working. And this is why when people say, well, if you get the side effects, it's a good thing, immune system is working, then you're leaving out those folks who are about 50% of the folks who would get nothing. That doesn't mean you're not getting your immune system trained. It's just that your immune system doesn't create too many inflammatory cytokines to this antigen. And that is fine. Training is still happening until somebody has immune system deficiency. Immune system deficiency, people know that they have a deficiency. They cannot handle infections. They cannot handle being around other people. So a person who doesn't have this kind of a thing already with them, they don't have the deficiency. Yashi says, love from India. Thank you very much. Love back to you. Muhammad Qasim says, question, sir, how Verafin acts? What is its role in COVID-19? So I had actually talked about Verafin a couple of days ago. So I'll have to look it up again. I'll talk about it. It skipped my mind. Yes. Westfield says, is your son in medicine? I really wanted my sons to be in medicine, but they both went my other profession route, and that is software engineering. So they both became software engineers. Logic says, who has more neutralizing antibodies? People who had infection with COVID or people who are full vaccinated with Pfizer or Moderna. Logic, you're going to get this channel closed. So shut down. So here's the deal. I'm going to say what is right, and then we'll see if they turn the channel off or not. There has been a lot of messaging that vaccines produce more potent, better antibodies. And there is a reason for that as well, and I can explain it if needed. I've done that a couple of times before as well. Full blown infection is so dangerous that it can kill a person. And if you are able to recover from that, then what else do you need? Your body was able to take care of it. What is the vaccine going to do now? Teach it to take care of the same infection in a different way? So I think that vaccine is not needed if somebody was able to take care of the infection. And I have always repeated this, unless there are variants that are different from the first infection, I still feel that the body which could take the first one could take the second one as well. Or the person's own health has deteriorated. For example, they become out of control diabetic, or their immune system has become suppressed, or they had an organ transplant, or they are taking steroids that they were not taking before. So in all such cases, it is interesting to then look at the vaccine once more. Otherwise, if you just fought with the infection, you have things that are taking care of it. And I have seen both sides of the point of views. They're both interesting. They're both theoretical possibilities. But come to the practical side. You just got infected and you recovered. Now, what is vaccine going to do? Unless it was not SARS-CoV-2, unless it was a common cold, you thought it was SARS-CoV-2. So meaning if you're confirmed COVID positive, recovered, and no other health issues, it's fine. Sir, is second dose ASA vaccine safe immediately after periods for clotting issues? AstraZeneca. Second dose. So if you have reached the second dose, we saw AstraZeneca's clotting issue with the second dose were present but less. They said it is rare. They said that with Johnson and Johnson as well, that the most occurrence is with the first dose, second dose is rare, but the chances are still there. So ideally, if nothing happened after the first dose, then chances are even rare that something would happen after the second dose. Anand says, my relative having severe reaction to CT scans iodine-based intravenous injection. Will it be safe to take Covishield vaccine shot? Kindly share your opinion. So the problem is the same. If somebody has severe allergies, so if we can categorize them as having severe allergies, then they have to be very careful to take it. They have to take that in the presence of a facility or in a facility that is ready with EpiPen and taking care of it. Otherwise, they may develop allergic reaction as well. MS Hami says high ALT and high AST. So high ALT and AST levels, 26.2 blood. Also high good and bad cholesterol. Should I be very wary of vaccine or should do prophylaxis? So this does not rule you out from vaccine. So high ALT or high AST, some liver issue, but vaccine has nothing to do with that. Vaccine would create inflammation. It would ask liver to make some acute phase proteins. If liver does not make them to the right amount, then what? So I don't think that this is a contraindication. But of course, the first thing is to talk with your doctor. Hot chili bean says, Dr. Bean, I like it. I like it too. Funny. Thank you. So William, how long does it take to get rid of vitamin D toxicity? So William, are you okay if I can share some of that, or would you give me a sign. So ideally, vitamin D toxicity should be taken care of. Vitamin D is continuously being used. So if the amount has gone more, it would actually come down if you don't take more vitamin D. Dinner is getting ready. It would start coming down very fast. So few days. So William Goff is giving me permission here in your presence. William has gotten his first vaccine dose. After that, he has been having GIT issues, gas, bloating, eating anything causing GIT issues, and then pain. And he lost 20 pounds of weight during this time as well for his inability to eat. Um, and this has been going on for 2-3 months. In this process, William at one time thought that he is developing clots. He even ended up in emergency. Eventually, so this is what I love about Cool Beans, that they are so smart. We have been working on these things together, that they can actually traverse various avenues and think about what may be happening. So William says that while one day something clicked that maybe my vitamin D level. So he had used a at-home vitamin D test, and the numbers were in 40-50s range. William, I may be skipping some information. Please comment with the correct one if I make a mistake. William has been in touch with me during this time as well. So he thought maybe my vitamin D levels need to be tested. So he got them tested from a professional lab, and they were more than 100. So again, we have been seeing that 30 to 100 has been put in a safe zone. We also know that many folks put comments over here that there is nothing called toxicity and so on. But William stopped vitamin D. And the next day, he says when he woke up, his symptoms of GIT disturbance were much better. And since then, they had been becoming better. Now you just saw his question that how long would it take for the toxicity to go away? So please realize that it is not necessary that everyone would respond in a similar way to vitamins, and please keep your levels correct, but not extra. So William, I hope you are recovering fine, and please tell me or I'll ask afterwards. Inigo Cox says, hello, Dr. Bean. Is it true that innate immune protection for a new variant can be reduced if you were vaccinated against another variant of that virus? Not at all. And let me explain the science a tiny bit. So innate immune protection from taking a vaccine against another virus. So let's say here we have a virus, and I'm just going to make this square thing here on the virus. Let's say the spike proteins are square. That is the peculiarity of this virus. And so what happened was the dendritic cell picked it up, presented it to a naive T cell, pieces of it, right? Pieces of it, some piece here. Naive T cell went T helper 2 pathway or T helper 1 pathway, or both of them with some percentage, one and the other. And then we got the antibodies. Now, important thing to understand is that the antibodies that are produced against this virus's epitopes. So let's say we have this virus, or let's say this is a vaccine. So we only have this epitope, the spike protein. So I'm going to make spike protein over here and say, let's say this was an epitope. Epitope is an area on the spike protein that is useful to attack. So this B cell will make antibodies, let's say, against this part. Good. So now if the actual virus of this type arrives in our body, our B cells have become memory cells. They are sleeping. They would just wake up and they'll make antibodies, and they would take care of this virus within 24 to 48 hours compared to spending 2 weeks getting ready. Now, let's say another virus comes in. So is the innate immune protection for a new variant can be reduced if you're vaccinated against another? So let's say this is a variant now. So the variant has the spike proteins that are different, slightly different. 1%, 2%, right? If they are too different, we are talking about a new virus. That's why I'm saying it is a variant. It's slightly different. So when that virus now arrives, what will happen is, imagine this B cell for a second. If this B cell, and you know that from the previous vaccine, there are going to be many epitopes, not just one. So there are many epitopes in the spike protein that are present. So that means there are many sleeping memory cells as well. Now comes the new virus, changed virus. Now this virus, let's say, has 90% similar epitopes and 10% is changed. Although I'm being generous here, because so far even the most drastic changes are 0.3%. So they're not even 1% changes. So they're so low. So I'm giving 10% change. So there is a change. And that change has somehow caused, for example, the vaccine came in, these viruses, now these sleeping cells, they will only wake up when some epitope attaches to them again. So then they would wake up. So let's say this spike of this new virus, 10% is different and 90% is the same. So if this B cell here is able to recognize some part in the 90%, it's going to wake up and start attacking it. Now let's say this 10% here was here, and this B cell A was responsible to attack a part of this 10%. And this B cell was not able to connect here because this part is not binding to this B cell. By the way, B cells have IgD on them, which acts as a receptor. So the B cell has to now connect with this changed variant. And let's say this B cell failed to connect. Doesn't matter, for that B cell, there is no infection. For other B cells, there are infections and they all become active and they start responding to the virus. Ideally, that is sufficient to take care of this virus as well. But to go to your question, I'm going to take two more paths here. Let us say all of them fail to respond. We'll take extreme examples to kind of understand the concept. Let's say they all fail to respond because the change in the spike protein is so drastic that it is just not very similar to the one before, which means it's a new virus. But let's go with that for a second. If this has happened, that means to our body, this is going to act as a new virus, and our body would start the same process once again, dendritic cell to naive T cell to B cells to cytotoxic T cells, and 2 weeks of work. That means if there is some 10% difference as well, that 10% difference is also going to go through the same process. If the body decided to attack that 10% part, it is going to, if it has not already within 24 to 48 hours taken care of the virus, and the virus is still roaming around, then the body is going to start figuring out how to attack that 10%. And now the person would respond to that in 2 weeks. Then the third part of your question, will this actually somehow cause the innate arm to become compromised? There is a possibility of T helper 2 cells, active T helper 2 cells, to release interleukin 10 that cause the innate arm to become calmed down. But that only happens when they are active, and they can also not suppress them, they can only modulate it. Not even enough to stop the function of the immune system, but just enough not to cause cytokine storm. So now let's say this person had a vaccine and then all the system is just sitting, sleeping, this new virus came in. What is the mechanism that would cause these B cells and T cells to somehow attack the dendritic cell and or macrophage or natural killer cell or neutrophil to destroy them? There is no such mechanism at all. So now let's do this. Let's say somehow we want the innate side to be deficient, to become depleted. For that, what we have to do is create active immune suppression by either giving steroids or by destroying the bone marrow of a person. So let's say you bring in a virus that goes and destroys the bone marrow. Fine, the person doesn't have immunity anymore. Or you bring in some sort of a virus like HIV that goes and destroys the helper cells or T cells. Fine, now the person has a problem with the immune system. So you bring in some virus that would infect these cells and destroy them. Then you can say, yeah, sure, innate arm is gone. Otherwise, innate arm cannot just be destroyed and depleted. And here is some very simple things to consider. Let's consider lifetime of an NK cell, natural killer cell. In addition, NK cells are short-lived with an average lifespan of 2 weeks. And NK cells are being made every day, and the ones that were made 2 weeks ago are dying today. So I'm making new every day, and just like human beings, we are born every day and we are dying every day. NK cell, so let's say the NK cell, when will NK cell be depleted? When the bone marrow cannot make them anymore. So if I translated your question to this, that, hey, is this possible that some vaccine would cause the bone marrow suppression? Then that's a different question. We haven't seen that vaccine yet. So we have to talk about some specific vaccine to say this vaccine is going to cause bone marrow suppression. If the bone marrow suppression occurs, then NK cells are going to go down, macrophages are going to go down, dendritic cells, helper cells, B cells, T cells, and the whole thing is gone. We are specifically trying to make the innate arm depleted. So NK cell, not possible. Let's look at macrophage. Maybe macrophage live on for 1,000 years, and if we destroy them somehow, we haven't yet seen the mechanism in this here, that how would the innate arm be attacked by a B cell making antibodies. There is no such mechanism. Unless you tell our immune system cells to make antibodies against the innate arm by giving a vaccine, but that would not work. Why not? Because our cells have something called energy, ANERGY, energy. When our immune system cells start working in our body, they are trained to say, would you try to kill our own cells? And the cell has to promise and say, I will not kill our own cells. And if the cell says, no, I would kill our own cells, it's like an army man saying, I'm going to attack my own people, then they kill that cell. Similarly, if they would say, would you be also able to find the foreign substances and attack them? And the cell has to say, yes, I would attack them. And if the cell says, no, I cannot attack them, then that cell is also killed because it is useless. So how can we give a vaccine? Let's say we give some vaccine which looks like NK cells part. And we are hoping that that vaccine would cause the B cells to make antibodies against the NK cell. When that little piece is given, isn't that the piece of our NK cell? Don't our NK cells already live in our body? If our body was going to create an autoimmune mechanism, wouldn't that have already been done because it was already in us? So that's not going to happen. Similarly, if you see macrophage, lifetime of a macrophage. Macrophage can eat about 100 substances and then they die themselves as well. So unlike monocytes, macrophages have a long lifespan ranging from months to year. So they can sit in the system from months to year. Now, if you destroy them, there would be new macrophages that would come and live there. We make monocytes every day, which convert into macrophages. So let's look at the monocytes lifespan. We found that classical monocytes have a very short circulation lifespan, 1.0 to 0.26, I believe, days. Most cells leave the circulation or die, whereas the remaining cells transition into monocyte, intermediate monocyte, and so on. So there is no innate arm cell that one could be destroyed by the giving a vaccine and activating the acquired arm. And number two, even if it is destroyed, that will not be reproduced. So you will have to, so let's try to create some mechanism to do this. What you'll have to do is the following. You'll have to say, Either give some vaccine, some drug, something. For the chemotherapies for cancers are these things that is going to go and destroy the bone marrow. Fine, now you suppressed it. Give steroids, you suppressed it. Somehow inject cells. For example, when the organ transplant occurs, when bone marrow transplantation is given, sometimes it is possible that the previous donors T cells and B cells and the other cells would come and attack our body as a foreign body. So either do that. If you tell the vaccine that, hey, go and train the immune system to attack the innate arm, then you have to somehow tell the body that our innate arm is somehow an enemy. And there is no way a required arm can look at our own innate arm and become an enemy to that. This is called tolerance. This is called energy. So there is no such mechanism. I went on for a long period of time. Sorry. So let's do this. That so let's answer a couple of more questions and then we break for today. Fun says question. So generally, if you got COVID between the 2 doses and you recovered, there is no need to take the second dose, right? If you got COVID and you recovered, if COVID didn't end up killing that person, they have all the protection and their system knows how to work it. So my answer is still the same. Unless their immune system got destroyed by, let's say, chemotherapy, organ transplant, radiation, some cancer of some sort, some infection of the bone marrow cells, so, or some hematological disorders that destroyed the bone marrow and caused fibrosis over there. So there are many ways that bone marrow can be destroyed. So either the bone marrow is destroyed or the virus has changed so much that the previous memory is of no use. Only then it is useful. Otherwise, I don't see a reason. Ian Mercy says, do you think that the mRNA vaccines have a high risk of cardiac-related side effects like myocarditis or tachycardia due to the spike protein? So I have discussed this multiple times before. The spike protein, when that is generated, and now my wife is looking at me to say I'm going to start cooking. So here, let's see. Let's say we've given the vaccine. Here is the vaccine. Now, vaccine is injected in deltoid muscle. In here, there are lots of fibroblasts, there are macrophages, there are dendritic cells. These little kinks are my way of making different cells. And there are muscle cells, and there are tons of types of cells here. These cells are going to start picking up the vaccine right away. Remember, it's a very tiny dose. They're going to start picking up the vaccine. When they pick up the vaccine, we have done this discussion as well. When a cell picks up the vaccine and makes a spike protein, that spike protein is not really allowed to go out. And I've done this discussion that there is a possibility when the cell breaks down, some spike proteins can come out. But even then, they are going to be immediately picked up by macrophages in the vicinity, and they're going to eat them up, or neutrophils or other cells. So it's not that these are going to run away. So let's say the vaccine comes in, spike protein is made, it is then chopped up, it is destroyed, and then it is presented on the surface. The pieces of it are presented on the surface. Those pieces are then looked at by the immune system, and the training occurs. So for a vaccine to send the spikes in the body is not possible. For a vaccine to send inflammatory cytokines in the body is possible. For example, my Mrna shot here probably sent enough cytokines that my jaw pain continued. Somebody's menstrual cycle becomes irregular, or somebody develops, let's say, joint pains. So these are not the spike proteins that are doing it. These are the inflammatory cytokines and inflammatory responses. So I hope that answers that question. Couple of more questions and then we stop. Anubhav says, they did a study where they found out that AstraZeneca was able to neutralize the Indian variants in vitro. Your thoughts? I should expect that. because these variants are not something that can just escape so easily. They are 0 point something percent changes. 1, 2, 3, 17 changes, 17 amino acid changes. That is nothing. Important thing is how critical the area is. For example, in my whole body, you make a change and close my mouth. So you can say, well, this is just a 1% change, but now I cannot eat and I'll die. So if the area of the change is critical, for example, on spike protein RBD or for fusion proteins, then it can become that the virus can become more contagious, as we see. But the rest of the virus is still the same. We are still going to attack that and we are going to destroy it. Inigo Coke says, thank you, Dr. B. You're very welcome. One more question and then we stop. How about that? There are so many questions. DH says, Dr. Bean, how long we take ivermectin for prophylaxis? 3 months, 6 months, or a year? This is not known. So, of course, the point of prophylaxis is to continue to take it till you feel that I'm not at risk anymore. But this is not really clear that long-term use of ivermectin will do what. If you think about it, if you think about Dr. Corey's discussion on my channel, he had said that, hey, take it as long as you want to. But we do not know. We don't have the data to see what really happens. John Snyder, thank you very much. Aruj Som, so this one more question and then we stop. The new drug approved in India called Virafin promotes development of interferons. Yes, I had forgotten. Should we have this medicine when getting vaccinated to improve production of antibodies? So the job of the interferons, this alpha-1 interferon that they do, the job of that interferon is to actually kind of reduce some of the activity of the inflammatory system and strengthen the cells. So I don't think it is needed. Mel says, yummy dinner if you don't miss it. Yes, I am going to be thrown out of the home. Actually, I am really grateful to my wife that she has over a year kept her schedules in such ways that I can do this with silence, and she would have to figure out something else to do. Girish says, deaths are very, very high in India. I'm seeing almost not less than 5%, 10% deaths. We're not understanding what to do. Question for 6 hours was cremation in Bangalore. Remdesivir, 25K for a while. So look, I was calling some friends this morning and saying a very simple thing to do is to do social distancing, wearing a mask. So those behavioral things should kick in right now. In some parts of Pakistan, they have sent army to lock down some of the cities which had become hotspot, because they're thinking if they didn't control it, they're going to end up like India as well. So I think controlling the meetings is important. Second thing, from my point of view, I would always keep saying those supplements, vitamin D's, C's, hydroxy, zinc, and ivermectin are very, very important to take at this time. Then is the next step. And I believe some of the folks should try to use budesonide-like things or steroid-like things earlier to see what happens. Higher dose of ivermectin, and I think that should work. Exacerbate says, India is reporting more severe COVID in vaccinated individuals. I think I have to see the data to see why is it severe. I don't understand that it would be. But it is possible. I have to look at the data. So last question. James, question, you mentioned after vaccination on a day 5, the antibodies will start forming. So is it safe to use anti-inflammatory drug after 5 days from vaccination that will not interfere with the vaccine? Yes. Yes, anti-inflammatory are not strong enough. Think about it. When we have a fever and we take anti-inflammatory, if they were so strong to suppress the immune system, then the whole thing, the infection and everything would go away. Or infection would persist, but immune system response would go away. But that does not go away. So, and the example is if you take anti-inflammatory now and tomorrow, and then day after you leave it, the fever kicks back in. So immune system does not get bothered by these anti-inflammatory, they help you feel better. Cool. So thank you very much for your time today. We'll continue with our discussion tomorrow morning. Please like, subscribe, and share. And there are 3 links in the description if you would like to support this work. One is to buy me coffee. Another one is to use Patreon and become a patron. And then there is another link to support this work in general. Thank you very much. Stay safe and happy and healthy. And I would see you tomorrow.